Responsible use of antibiotics belong to the family of beta-lactam antibiotics and are also famous for being one of the first antibiotics discovered. In 1928, Alexander Fleming had serendipitously discovered that the mold Penicillium notatum is able to secrete a substance lethal to bacteria, penicillin. Natural penicillins are able to treat gram-positive bacteria, such as streptococci, enterococci, and staphylococci, and are still considered to be a cornerstone of treatment of pneumococcal pneumonia, angina, scarlet fever, and erysipelas. Most common side effects seen is allergy to penicillins. In recent time, staphylococci have evolved to be almost completely resistant to it. Aminopenicillins have a similar effect against gram-positive bacteria, as well as added effect against gram-negative bacteria, such as Enterobacter species. They are commonly used in combination with beta-lactamase inhibitors, clavulanic acid, which significantly expands their range of action against bacteria that have already developed beta-lactamases. Aminopenicillins are most commonly used for sinusitis, middle ear inflammation, exacerbation of the chronic bronchitis, and community-acquired pneumonia. Anti-staphylococcal penicillins are most appropriate for staphylococcal infections, and even then only against those staphylococci which are not yet methicillin resistant. In addition, they are efficient against enterobacteria, streptococci, Pseudomonas aeruginosa, and some anaerobic bacteria. Most commonly used representative is piperacillin in combination with tazobactam, together representing one of the most potent combinations used to treat severe hospital infections. Cephalosporins are divided into 5 generations based on their spectrum of efficiency on the various types of bacteria. First-generation cephalosporins are most useful against gram-positive bacteria and are used to treat various skin and soft tissue infections in patients sensitive to penicillin. Cefalozolin, as an example, is also used for antibiotic surgical prophylaxis. Second-generation cephalosporins are useful against gram-positive bacteria, but with an added effect against community-acquired gram-negative bacteria. As such, they are useful in treating respiratory and urinary tract infections. Their effect on the pneumococcal pneumonia is weak. Third-generation cephalosporins are good against both gram-positive and gram-negative bacteria, as well as against Pseudomonas aeruginosa. As such, they are used for the treatment of bacterial meningitis, community-acquired sepsis, and community-acquired pneumonia. Cephalosporins with anti-pseudomol activity are used in treatment of febrile neutropenia and severe hospital-acquired infections. Fourth-generation cephalosporins are useful against gram-positive and gram-negative bacteria, including Pseudomonas aeruginosa, and are reversed for the worst hospital-acquired infections. Fifth-generation cephalosporins show promise in treating the notorious methicillin-resistant Staphylococcus aureus, or MRSA. Carbapenems are antibiotics characterized by an extremely broad spectrum, efficient against gram-positive and gram-negative cocci, gram-negative bacilli, anaerobes, and Pseudomonas aeruginosa, and are preserved for the worst hospital-acquired infections, in particular ones caused by mixed bacterial flora. Sadly, some bacteria have already developed carbapenemases, which is quite worrying as these bacteria were already multi-resistant to begin with. Aminoglycosides are used mostly parenterally or topically in single daily doses. They are most effective against gram-positive bacteria, even against rarer species like Yersinia plague, Brucella, brucellosis, and Francisella, tularemia. Aminoglycosides can be used alongside penicillins and, used together, they have a more broad effect in serious diseases such as endocarditis. Their toxicity limits their use, as they are notoriously toxic against kidneys and inner ear. Therefore, it is imperative to control blood levels frequently. Although differing in structure, macrolides, ketalides, and lincosamides have a similar mechanism of action. Macrolides and ketalides work against gram-positive cocci, but unfortunately, resistance to them is on the rise. They are useful for respiratory tract infections in patients sensitive to beta-lactam antibiotics, as well as for atypical pneumonia and infections caused by mycobacteria, Borrelia, or chlamydia species. Macrolides often cause gastrointestinal side effects, such as cramps, nausea, and vomiting. Erythromycin and clarithromycin inhibit a family of liver metabolic enzymes, CYP3A4, which can result in increasing the plasma concentration of other concomitantly taken drugs, metabolized by the same enzyme, leading into further side effects. Clindamycin is useful against gram-positive cocci, as well as against gram-positive and gram-negative anaerobes. It is used for treating staphylococcal and streptococcal infections in patients sensitive to penicillin, notably to treat mixed flora, intra-abdominal and pelvic infections. Tetracyclines are extremely broad in their spectrum of action. They are used in atypical pneumonia, sexually transmitted diseases like chlamydia, in infections caused by rickettsia, anaplasma, and coxiella. Tigecycline in particular is highly effective against notorious multi-resistant bacteria like methicillin-resistant Staphylococcus aureus, as well as vancomycin-resistant enterococci. It is reserved for severe skin and soft tissue infections. Tetracycline are deposited in teeth and bones of growing children. Therefore, their use is contraindicated in children under the age of 8 and during pregnancy or nursing. Addition of a fluorine molecule to an old class of quinolone antibiotics allowed for a renaissance of the whole class, creating a significantly more potent class of fluoroquinolones. Older fluoroquinolones are useful against gram-negative bacteria, while newer ones broaden the spectrum to involve gram-positive cocci, as well as some anaerobes. According to their spectrum, they are used for treating urinary tract infections, intra-abdominal infections, digestive tract infections, as well as respiratory tract infections. Fluoroquinolones can cause arrhythmias, liver damage, hemolysis, and epileptic seizures. Thus, careful use is advised in elderly and cardiac patients. Sulfonamides, trimethoprim, nitrofurantone, the urinary tract trio. Sulfonamides and trimethoprim applied together have an improved effect combined than each given separately. Their mechanism of action involves disturbing bacterial synthesis of folic acid at two separate points in the metabolic process. They are the cornerstone of treating urinary tract infections. However, in recent times, rates of resistances have grown sharply. They still remain useful for some rarer bacteria, like Nocardia or Listeria species. Nitrofurantoin is a urinary antiseptic with a yet unknown mechanism of action, useful against some urinary tract infections caused by Escherichia coli, Citrobacter, staphylococci, and enterococci species. Side effects are rare, but it is connected with lung fibrosis, nerve damage, and liver damage in chronic use.